Hi, my name is Michelle Fox. Welcome to my presentation on a cross-cultural assessment of Italy for the class Cultural Diversity, Spirituality, and Ethics in Healthcare. Here's a few of the demographics comparing Italy and the United States on things as total population, gross national income, life expectancy at birth, probability of dying under the age of 5, probability of dying between 15 and 60, and total expenditure on health per capita between the both countries. A brief history of Italy is that it was born in 1861 following a successful revolution to separate Tuscany, Modena, Parma, Bologna, Romagna, Lombardy, and Venetia from the Austrian Empire. The official language of Italy is Italian, but they have over 30 distinct dialects of that. Roman Catholicism has been a huge presence in Italy, but there's also Jewish, Hindi, Buddhist, and beliefs that are practiced by some citizens. Additionally, in rural areas, traditional folk spells are used for things like making birds stay out of a newly planted field, making warts disappear, and even making dogs go away. Unfortunately, only 22% of Italians aged 25 to 35 years old seek a higher education. It's in comparison to an average of 39% for the rest of the world, according to the Organization for Economic Cooperation and Development. In Italy, the largest age group is age 45 to 59. They excel in engineering and metallurgy professions, like that Ferrari above that picture. It exports large amounts of olive oil, tomatoes, and rice, but it imports much of its meat. Despite the fact that they need to import raw materials, the chemical sector is very active, and textiles make up one of Italy's largest industries. The agricultural industry is larger in the southern half of Italy than it is in the northern. When it comes to healthcare practices, a large portion of the Italian population, almost 70%, practices self-medication techniques. The number is significant, though, because 2/3 of those cases result in inappropriate self-medication practices. So there is a great need for patient education on medication administration in Italy. The Italian healthcare system is based upon the belief that every citizen should have access to healthcare and that the system covers all needed procedures. The access to healthcare is admirable, but does the system have weaknesses? Yes. Studies show that there are med discrepancies in 92 out of every 366 patients, with the most common discrepancy being an omission of a prescribed medication when a patient transfers from one level of care to another. So how is the Italian healthcare system ranked globally? The Italian healthcare system is ranked differently depending on which source one looks at. For instance, the World Health Organization and U.S. News and World Report both rank Italy's healthcare system as number 2 in the world, second to France. However, according to the Letigum Institute's Prosperity Index, Italy's healthcare system was not even ranked among the top 13 countries globally. In conclusion, there is a need for counseling and teaching for self-medicating behaviors for Italian patients, for over-the-counter medications. There is also a need for assessing for beliefs and folk spells as healthcare practice for rural patients. And there's a need for better handoff techniques from one level of care to another so that medical errors and omissions can be reduced. And here's page 1 of my reference section. And here's page 2 of my reference section. Thank you for listening.